Hello, and welcome to the Dr. Suzette Glasner Podcast. Don't forget to hit like and to subscribe to my YouTube channel if you want to continue to learn from me. Today, I'd like to share with you the findings of a recently published study that's really a game changer in terms of the way that we think about the relationship between teen mental health and their use of electronic devices, especially phones. Historically, we as a scientific community and as a society have been very focused on a single metric, and that metric is screen time. How many hours and minutes did you spend on your screen on average this week? But it's really hard to interpret what that metric means because a lot of us are using our devices, and our young people increasingly are using their devices to do work and to do research and to socialize. And it's really a one-stop hub for a lot of different aspects of our lives. So how much screen time is actually too much screen time? And what this research study shows is that we should be shifting our attention away from screen time as a single go-to metric or indicator of how our relationship with our devices is looking from a health standpoint. And we should really be looking a little bit more of the quality of that relationship. What are we using our devices for? This study found that total screen time was not what mattered. It was the addictive nature of their use. And so when we talk about addictive nature of use, you think about the symptoms of addiction to a substance that we have defined very well in our practice of psychology and addiction medicine. And the way that we understand addictive use is that it becomes increasingly difficult for a person to control their use. So they end up spending more time scrolling or on their phone or playing video games than they intended to. They're finding that they're giving up other things that they otherwise would have been doing and valuing, like time with family, other recreational activities, in the interest of spending more time on their phone or on their devices. But most notably and interestingly, given that it's not a substance that is a chemical that you're ingesting inside of your body the way that alcohol or other drugs are, there's a withdrawal syndrome where people feel a sense of distress when they're away from their devices or when they're not actively using their devices. And it's almost like they're experiencing cravings or urges to be on the device when they're actually not on the device. And we see this a lot with alcohol and drug addiction. And it's those types of symptoms that is predictive of suicidal thoughts and behaviors. So our understanding of the implications of this research study is that kids who are using the phone as a means of escaping from other unpleasant emotions or symptoms are the ones who are at elevated risk of mental health struggles and specifically suicidal thoughts and behaviors. And this isn't all that surprising because when you think about it, if they didn't have their devices, what else might they be doing in order to find outlets for uncomfortable emotions? We know people who have anxiety disorders, if they try to escape anxious feelings or avoid anxious feelings, the anxiety tends to get worse. So if you can imagine, if teenagers are using their devices in order to avoid certain feelings that are very unpleasant, especially anxiety, which is so common at that age, then that could in effect be making their anxiety symptoms worse and worse. And because their primary go-to to cope with it is an escape tactic, they're not really learning how to be present with unpleasant emotions like anxiety and find a way out of it that is a little bit more skillful, a little more healthy, and that's going to help them to solve bigger problems that they're going to encounter in their lives. So let me just take you through a few of the specifics that were found in the research study. So what they did was over 4 years, the researchers tracked over 4,000 young people starting around the age of 10. What they were looking to learn is what their trajectory or their pattern from age 10 over several years was looking like with regards to their relationship with their devices. And what they were looking to understand was groups that were following a trajectory that looked at high risk for addiction potential versus low addiction risk. And the ones who had a high addictive use trajectory, meaning they were showing signs and symptoms over the years from age 10 to around 14, those individuals were significantly more likely to report suicidal thoughts and behaviors, as well as symptoms of anxiety and depression, and even aggression or rule breaking. They also found that there were different relationships depending on the type of social media. So for social media and mobile phones, the high and increasing addictive use trajectories were associated with a doubling or tripling of risk of suicidal behaviors and thoughts compared to people with a low addictive use trajectory. So the bottom line is what mattered the most was not how much time they were spending on their devices or on video games or on social media, but it was the way they were engaging with screens and whether they were showing signs of compulsive use of the screens, distress when they were away from the screens, or loss of control. So what can be done about this? As a parent or caregiver of somebody who is between those tween and teen years, the go-to in prior years has been limit screen time, and that will prevent the development of addictive behavior. The idea of limiting screen time is not invalidated by this study. So you can still impose some screen time limits to make sure that your kids are attending to the responsibilities that they have with academics and with other activities without the disruption of the phone. So there's definitely still some value in limiting screen time. But the way in which you would prevent an unhealthy relationship with one's device, that is a little bit different and maybe a little bit less directly tied to what they're doing vis-a-vis the phone itself as far as how much they're on it. The strategy there would be to teach them some skills for coping with their feelings. So that could be mindfulness meditation. There are mindfulness classes, and mindfulness meditation just gives them one coping tool for dealing with anxiety or frustration or depression. There's also cognitive behavioral therapy. So if you can get your young person plugged in with a therapist to help them just develop some basic coping strategies for what do I do when I feel anxious? How do I breathe my way through that, or think my way through that, or identify what's causing it and learn how to solve the problem? It's like basic life skills that will reduce their need to rely on the phone as a means of escaping or coping. And then there's engagement in healthy outlets and activities. One thing that naturally will limit screen time is if your young person is able to find some activities that they just love doing that naturally pull them away from a screen. So really going on the hunt for the right sport or hobby, finding a predictable routine-like schedule that does sort of naturally put some guardrails against excessive screen time, but also gives them some very healthy outlets for intense emotions. We know that sports are a great outlet. We also know in general that mental health of young people is better, and the risk of addiction and other types of psychiatric problems is lower when they feel a positive connection to their school. So helping them to find clubs, activities, extracurriculars, even if they're not sports, drama, whatever it is that they love, helping them to really hone in on that and develop it and make it a bigger part of their life and the way that they're spending their time. Naturally, there just becomes a little bit less space and time for all these screen-related activities when you have a lot going on, when you build a rewarding and fulfilling life. And that's the challenge that we're all facing in adulthood as well as we transition through different phases of life. So it's really good modeling if you're also doing that yourself. So I hope you learned something valuable today from our newest findings from this research study. It's not quantity, but it's the quality of the relationship with screen-based activities that really matters, and promoting good mental health through teaching coping skills and strategies and helping your young person to find rewarding, fulfilling activities in life that don't hinge on a screen are a very promising way forward. Thanks for tuning in, and I will see you next time.